So now I'm extraordinarily pleased to turn this over to one of our speakers, Dr. Beth Hallmark.
Great. Thank you, Andrea. I'm also happy to be here. And first thing I want to do is introduce our presenters. So we have John Mikovits, who is from Moravian University. He was one of our content experts. Brandy Fruin from Regis College also helped write one of the cases, but is also a content expert. Colleen Meekum from Villanova, who wrote a case, and Leanne Stephen from University of Fraser Valley. And all of these people have just put in so much work for this project. And I just want to say, first of all, how honored I am to be a part of this and tell you about the real compassion that they have for, and we all have for this group of patients that we're going to be talking about today. So I just want to say, first of all, how honored I am to be a part of this team. This is not an area of expertise for me, but I have learned so much. I have been so honored just to be a part of this and to learn so much more about the LGBTQ plus population patients. So the next thing I want to talk about is the inequities that we see within this population or within this group of patients that we take care of. As nursing educators, it's really important that we ensure that our nursing students and our nurses take care of all people equally, and that we are prepared to care for all types of patients. Traditionally, we have taken care of what you might consider the traditional patient, and we want to make sure that we expand that, and this is part of the work of this project. This project is supported from the Hearst Foundation, and they have worked with the NLN to help with the ACEs cases, or the ACEs cases that we're part of today. So they have worked with content experts and simulation experts to develop these unfolding cases. And we are teaching students about the individual needs of this community. This presentation today will really describe the development of the simulations and the teaching strategies and the links to these free resources. So I'm going to next talk about the session overview more fully. So the session overview, we will actually be talking about the Advancing Care Excellence series, and I'm going to talk to you about some of the different ones that we offer from the NLN, and then how we develop these ACE Plus cases and the resources that go with them. And then we're going to offer some time for questions. So next, let's talk a little bit about the Advancing Care series. The Advancing Care Excellence is an ongoing initiative that the NLN has developed, like I said, with the Hearst Foundation, and it's to improve the quality of care for vulnerable and underserved populations. So some of those different actual series have been things like the senior adults, the pediatric population, the persons with disabilities, now the LGBTQ. I was also involved in the work for the Advancing Care Excellence for Caregivers, which is an excellent product also, and then for veterans and Alzheimer's patients. So these are free teacher-ready curriculums that provide tools for you as educators to be used in a wide variety of settings. You can use those in hospitals, in rehab centers, long-term care facilities, in nursing schools. I even have colleagues in medical schools that have taken these and made them fit in their curriculum so that they've been able to use them. Again, we have those 7 populations, and each population has unfolding case studies and teaching strategies that we're going to talk to you a little bit about. So let's talk a little bit about how we can use unfolding case studies. So the difference between really a case study and an unfolding case is that typically a standard case study focuses on really a single issue or a problem. Many times a case study is a single presentation or event with really a narrow focus. So that focus is really different than an unfolding case. Generally, you get a lot of information about the patient or the client that is provided to the learner. And often a case study is an instructive example that it's faculty driven and it's not student driven. The case study usually emphasizes things like developmental issues and relationships within the environment that the patient may be in. Sometimes it's used to compare a larger group to an individual. An unfolding case is similar to things like a story arc or something you may see in a television series that unfolds, and from one week to the next you see different things happen to those characters. So the purpose of this story arc is really move the character from a situation from one state to another. In other words, you want to see change or affect change. This change or transformation often takes place as it does progress through those episodes. One common form is found as a character goes from a situation of weakness to one of strength. An example may be moving from an acute to a chronic stage, or from a chronic to an acute stage. And this unfolds as we hear or learn more about the client. An unfolding case can take clinical situations and issues that students might face and put them in a realistic learning environment, where the students may see it evolve over time. For example, the unfolding case may use the same patient along with their family, and you may see changing in conditions in the patient and in the family dynamics. And we've tried to do that as we've developed these scenarios. Students really are challenged to reflect in order to learn and understand in really a purposeful way with intentional encounters. So as we developed these cases, we developed them with different situations where they had intentional encounters so that they could see how the patient pass through the acute stage or the chronic stage and through the lifespan. They're evolving, they're an evolving nature, and these cases that unfold like this lend themselves to examine the continuity of care of a patient, the experiences that they may see at different levels of care or different care areas, such as the emergency room or the outpatient center, or a place maybe in a community center where they may be getting care. This modality is really flexible, and it allows us as a faculty to incorporate each portion of the unfolding case into the curriculum at different points and where it fits related to your outcomes of your actual curriculum. Unfolding cases also have advantages where they can, in that they can be developed and used in multiple teaching settings to enhance learning. They have a creative way to integrate active learning into your teaching. And so let's talk a little bit about this unfolding case and the elements of unfolding cases that actually occur in our work that we've developed here and across all the ACEs encounters or ACEs cases. So things that you're going to see are first person monologues. These happen to be my favorite part and really what endeared me to the ACEs series and how I became involved in some of this work. One of the first ones that you'll see when you go into the ACEs cases is Millie, and everybody's going to smile because they know that I love Millie. Millie is somebody in the seniors, I believe, or the seniors. And so these are where we have recorded and actually hired actors that are voice actors, and we try to find somebody that fits this patient to the best of our ability so that you get the real sensation and the student gets the real sensation of what this patient may be like. That can be used to introduce the case or to transition the case to the next encounter. And we're actually going to play some of those for you in just a minute, for these actual cases that we've developed. And part of this is also 3 simulation scenarios with actual chart materials. This can be developed using the NLN simulation design template, which is a very popular template. And if you follow the healthcare simulation standards of best practice, you know they recommend using a template. And so we use a template to develop these. It really helps you make sure that you're following those standards and that you're finding the important elements in a simulation. It can be downloaded from the resource center in the educator's toolkit. And I think Andrea will probably pop that into the chat. Part of that is the patient description, the psychomotor skills that would be required, the cognitive activities that would be required prior to the simulation. So that's part of that pre-brief or that briefing that they get. The simulation learning objectives, which we know are very important to make sure the student understands. The simulation fidelity, how you set up the simulation to make sure that the student gets the best experience. The different roles you may see. So in some of these, you may see nurses, you may see other types of caregivers. And you can add those because these are totally editable also to meet the needs of your curriculum. You see orders, you see a timeline about how it progresses, and you see practice guidelines and different references, which are very, very important. And they're kept up to date too, and that's really important. And then you see debriefing questions. that we provide for you to actually have in the scenario, so that you can make sure that you have some direction. You don't have to follow the debriefing questions per se, but they're a great way to get a good start. And some other things that you may see is something like finish the story. This was designed early on in the ACEs work, and the finish the story is a design element that can really be used in class discussion, and it allows your students to take the client from where they ended in the scenario that we've developed, and then actually go forward and be able to think about what they may be like in, say, 3 months or a year. You have to give, or you may give your actual students some criteria about what you want them to address in their finish the story, or you may give them freedom to do what they want. But it's a great way for them to consider what it may be like as a client when they go home, or when they have to be readmitted to the hospital. And then you also have instructor toolkits. The instructor toolkits are used as you plan the unfolding case, and you may find it applicable for the learners to complete other assignments related in some other way to the patient or the patient population and their care. Here's some examples. So the student presentation on a concept you may have them do. You may have them write a patient teaching plan, which we know is so important. A concept map, you may have them develop a concept map about the actual client that they've been taking care of. You may have them do reflective journaling. The great thing about these cases is you can use them how best fit in your curriculum, and you can model and develop things that may fit for you in your courses. So let's talk a little bit now about the ACE Plus Advancing Care Excellence for the LGBTQ population. This population has 3 different cases, and they are going to actually introduce you to each of the different clients and give you the opportunity to hear a little snippet of the audio so that you can get an idea of what these are like. So I'm going to toss this to John Mikovits, and I'm going to say goodbye because I have to go to another meeting, but I want to thank you all so much for your attendance at this, because I cannot tell you what an honor it has been again to learn from these experts about the LGBTQ plus population, and making sure that we as nurses, wherever we work, are taking care of our patients with honor and respect. So thank you, and I'm going to turn it over to John.
Thank you, Beth. So the way that the NLN has come to decide that the LGBTQ plus population is going to be the next population to cover in the ACE series was through a random sample through an NLN survey. Individuals that were surveyed were interested in learning more about LGBTQ plus population, but not necessarily the specific care that they needed, but just how to be more inclusive and more affirming with what we were providing to them. So that really was the focus on using inclusive and affirming language, not necessarily the specific needs of one group or another. And on the next slide, we'll talk about some of the health inequities that these groups face. As LGBTQ people become more visible, it remains important to know that LGBTQ plus people will still face these healthcare barriers. This is due to beliefs, attitudes, practices that have really been steeped in this oppressive societal culture that we're currently facing and have been facing for a while. Despite calls for patient-centered care throughout all of our professional organizations, nurses really still seem to lack some of that basic knowledge overall about LGBTQ plus patient care. And that can result in some really uncomfortable practice for us as nurses. And it can provide some really unfortunate attitudes towards this population, whether they're intentional or not. One of the most important things to consider, though, when talking about this population as a whole, is that while we use this umbrella term of LGBTQ plus to describe this population, each specific letter within this identity really is a person who has their own specific individualized needs. So it's important for us not to just group everyone under this umbrella term of LGBTQ because there are so many specific needs for each individual within this category. Now, when we talk about the framework that was used for this series, the unfolding case studies all incorporate a foundational framework. The ACE Plus Essential Nursing Actions is a really important component of this, and these essential nursing actions provide a framework for nursing students and practicing nurses to translate their knowledge of individualized care, complexity, gender identities, sexualities, communication techniques, during life transitions and put it into action. And this is done to promote high quality care for individuals and really the entire LGBTQ plus population. Use of these materials that are part of the ACE Plus and nursing essential actions and clinical experiences, different skills labs and simulations, and lectures really helps develop students' knowledge, skills, and their ability to relate to the care of LGBTQ plus individuals while still promoting more of these positive perceptions and overall humility of this population. There are essential knowledge domains as well. Some of those things focus on individualized care, the complexity of care, and then vulnerability during transitions. The individualized care really is for individuals who identify as LGBTQ plus and how they all experience different interactions within healthcare, which most often are manifested in unique ways by each individual. So assessing function and expectations of care really are essential. The complexity of care really shows that the care of LGBTQ plus people requires somewhat of a specialized knowledge and awareness, and really does take in both the art and science of nursing to help manage the multitude of factors that influence the quality of care. LGBTQ plus people represent some nurses' most diverse clients, yet nurses often unknowingly provide care to this population because of the lack of gender and sexual diversities in demographic screenings. Clinical experiences provide for students need to really focus on how to recognize, respect, respond to these numerous interconnected factors that are going to affect care and the multiple variables that impact equity and the quality of care for these folks. Early identification of preventable diseases may be missed if LGBTQ people avoid seeking care based on these prior experiences that have been discriminative and inadequate for them. The management of multiple coexisting acute and or chronic conditions may generate tensions between immediate and long-term needs, as well as healthcare providers and clients. Nurses should use appropriate judgment to observe, interpret, respond, and reflect based on their knowledge and the LGBTQ persons and caregivers' expectations. Vulnerability during transitions is also important to consider. LGBTQ plus people experience dynamic changes encompassing transition across their lifespan, including environmental, location, activity, legal, personal, or whatever other life events may occur. Transitions have the potential to create upheaval and disequilibrium of this population for both them and their families. And it offers opportunities for nurses and all of us to intervene in some way. Coordinating care during significant life transitions for these folks is fundamental to providing competent, respectful, and individualized humanistic care. Care must be more than a series of discrete services. Rather, this continuity of care must be provided when an LGBTQ plus individual moves along from multiple care settings. Communication between colleagues is vital to maintaining affirming care for these folks. The professional identity of the nurse is clearly evidenced in nurses' role as advocates for all people. As advocates for LGBTQ plus people and their loved ones, nurses have the ability to improve the quality of care provided and to incorporate older adults and caregivers' expectations for management of disease and promotion of health and healthcare equity. Nurses must consciously and affirmingly focus on treating their LGBTQ plus clients as people by maintaining function, control, dignity, and integrity to really promote their health. Now, on the next slide, we'll talk about how we have multiple unfolding case studies that were developed. Just a note of representation is that the ACE Plus unfolding cases were created as examples of LGBTQ plus people. The LGBTQ plus community and that population as a whole is incredibly diverse, and it's important to recognize that these three cases cannot be fully representative of the entire community. These three unfolding cases are opportunities for us to learn about the community, how to provide dignified healthcare in a foundational way for LGBTQ plus people. So on the next slide, you'll meet our first client. Our first client is Mike Walker. We do have a little bit of a clip for him to highlight some of his story through his own words.
Great, thank you, John. We'll play a piece of the monologue, which is intended to be used before students engage with the first simulation scenario.
Hi, my name is Mike Walker. I am having some health problems now, and it is worrying me. I have not been good about getting health care. I've had some bad experiences in the past with medical people not treating me well, so I have avoided going to see doctors. I feel like once they know I'm gay, they treat me differently, sometimes even harshly. It doesn't make sense to me. I am still just a man. Being gay has not been easy. Growing up, I attended a religious school and learned that being gay was not viewed positively. While I didn't know I was gay as a kid, I did know I was a little different than my peers. I followed the life course that was set out for me by my parents. Go to college, get a good job, get married, and have children. I met my wife Trudy in college. She was a science major and became a science teacher. I was a math major and became a math teacher. So we had a lot in common. We were good friends, got married, and had a pretty good relationship. It's not like being gay hit me over the head, but I didn't watch women the way other men did.
So that's an example of the way that we use some of those monologues to really paint a better picture of the story. So Mike Walker was our first client that we discussed, and he's a 70-year-old gay man who realized his sexuality later in life. So a little bit more background is that he is a divorced father, like you heard him say, and currently lives with his partner. So in the first scenario, he's being seen in the emergent care setting for GI bleeding. The goals of this first scenario are to complete vital signs, review an important past medical history and social history, and a focused GI and sexual assessment of him. You can see that we're not necessarily focusing on him being gay in this situation. The focus is really on incorporating nursing care into any sort of client, while Mike Walker does appear to be gay in this situation. Now, in scenario 2, this is 2 months later, post colon cancer diagnosis. So you can see on the arc of the story, he's progressing to a different stage. So this is looking at that transitions of care and that transition across a lifespan that we need to incorporate and consider for our LGBTQ plus clients. So 2 months later, he's diagnosed with colon cancer, ends up needing a blood transfusion. And in this scenario, his partner wants to provide blood for that. So the goals of this scenario are, again, to monitor vital signs, but also have interactions and incorporate the skills of the blood transfusion for that. So it brings an opportunity for our students to incorporate blood transfusions and learning about blood transfusions and reactions, et cetera, into this scenario. In the third scenario, this is the following day. So again, we're following the arc of the story. And now the provider, Mike, and his son, and now partner, are all having a discussion about plans for advanced treatment, chemotherapy or other treatment options. And there's a conversation initiated about palliative care, and the family becomes upset. So it brings in the concerns of the family, but now it brings in some more of the legal components, such as a non-family member's rights or advanced directives regarding the durable power of attorney regarding patient's care, because Mike and his partner are not married. Our next scenario is Jayla Wright, and our Brandy is going to have a conversation about Jayla and really share her story.
Thank you, John. If you want to go ahead and we'll listen to the clip of Jayla.
My name is Jayla Wright. I was assigned male at birth. My parents named me Jamal Wright. I am a 24-year-old woman of color. I realized at the age of 8 or so, I felt more comfortable in my sister's clothes than in mine. I have two sisters, and I always felt like one of them. I loved the pretend makeup they had, the nail polish, the gorgeous clothes, the sequin, the dolls. I loved all of it. I was often disciplined for wearing makeup and dresses, and my parents would scold me and tell me to stop acting like a girl. And I kept trying to tell them I am a girl. I have been on my own since I was 17. My family was not willing to accept me for who I am and essentially asked me to leave. Not many people understand the feelings one has when their parents and or families do not provide unconditional love. I have been estranged from my entire family since the night I left. Religion and going to church was an important part of my childhood, but sadly, I haven't returned since I was forced to leave home. I would consider myself faithful, but not actively involved. I am fortunate to live in a large metropolitan city where, if needed, I could lay low. While living on the streets, I met some really amazing people. I live with a few friends, and we found a great apartment building, and many of our neighbors are kind and welcoming.
Thank you. So I just a few things to address. Um, Please note that gender identity and sexual orientation are two separate things. It's also important to note that a person does not have to be transitioning and or starting the process to self-identify as transgender. So Jayla is identifies as female and she is heterosexual. When I was writing this, resiliency was really important theme for me within this. The strength this population embodies to live authentically, despite how horrific they are or maybe have been treated, is beyond admirable. Communication and upholding one's human dignity was the premise and kind of root for this. Oftentimes, this population will delay medical care due to previous negative experiences and/or the fear of what may happen. And let's look at the next slide. So she is a 24-year-old trans woman of color. She is a sex worker. Trans women, specifically trans women of color, are murdered at a higher rate than their cisgender counterparts. You'll see in scenario 1, she's at the emergency department due to a wound that she suffered exiting public transportation. In scenario 2, 3 hours have passed within the emergency department. And then in scenario 3, 6 months have passed. So some of the feedback we received mentioned this case study would be better suited per se in a mental health scenario. For us, this reaffirmed that the stigmatization, I'm not going to be able to say that today. In no way is Jayla experiencing and or has a history of any signs of symptoms of mental health or disorder or condition. It was also important to note family is not always blood related and support systems can look very differently. So in scenario 1, the focus can be on vital signs, tetanus vaccine, really the dialogue regarding reluctance to seek medical treatment. Faculty could add a head to toe assessment, but the time may be limited. In scenario 2, the focus was really on wound assessment, dressing change, meds if needed. And I really wanted to focus on the community resources within your community, right? Like I live in a metropolitan area, so my access to resources may look a lot differently than I live in a rural area. And I really just wanted to have your students and you see what resources do we have for this population. And then in scenario 3, from the resources that you found, she now is in an LGBTQ plus clinic, and we can focus on a health history and maybe an STI screening if that were needed. And then our next client is Zach, so take it away, Leanne.
Thank you. So we will listen to just a short clip from Zach's monologue.
Hi, my name is Zachary Miller. Everyone calls me Zach, so you can too. I'm in 9th grade and I live with my family. 2 brothers, 1 sister, and my mom and dad. And my older brother, he's going to college next year, so he'll be moving out soon. He got a basketball scholarship at a university about 6 hours away. Everyone is so proud of him. He's such a guy's guy. Everyone loves him. Anyway, I don't like sports much. I mean, I play soccer, but It's really only so that I can say I play a sport. I'm not very good at it. Always the last one picked for the team, and I'm known to try and score on the wrong net. I think my family must wonder where I come from at times, being so different from the rest of them. Mom and Dad both played sports in college, and my other brother is pretty good at baseball. Even my sister, who likes all things pink and sparkly and is in the 6th grade, is better at sports than I am. Yeah, I am really good at acting. I always get the lead in the school play. You know, when I'm on stage, it's the one place that I feel totally comfortable, because I can be the character in the play and no one judges me. I take on the personality of the character, and I don't feel any pressure to be someone else. I've been trying to be more like the other boys in my class, but it just doesn't feel right for me.
All right, so as you just heard, in that scenario, Zach is a 14-year-old and he lives with his parents and 3 siblings. And during the 3 unfolding cases, they follow him over a year and a half of his life. And during that time, Zach questions his gender identity and sexual orientation. He changes his name and pronouns, and he discusses feelings of isolation. So on the next slide, we'll look at the 3 scenarios. All of these scenarios focus on creating an affirming environment for a teenager and utilizing inclusive language. During scenario 1, Zach meets with the school nurse to discuss gender identity and sexual orientation. At the beginning of the scenario, Zach is asking questions for a friend, but if the learners create an affirming environment for him, he discloses that those questions are actually ones that he's asking for himself. And during this scenario, Zach asks questions. So he asks questions about the gender identity, his sexual orientation, and how to change one's name. He has concerns about how families might respond to and accept someone who is questioning their sexual orientation and gender identity. So learners, when they come to this scenario, really have to have a good understanding of how they might respond in a situation like that. Between scenario 1 and 2, Zach changes his name and pronouns to Alex and they, them, theirs. So during scenario 2, it occurs after Alex has been admitted to a pediatric unit because they have been hit by a car while riding their bike. And during this scenario, it's important for learners to use the proper pronouns when caring for Alex, as Alex is very sensitive about this. Learners also need to safely administer medication and complete a developmentally appropriate assessment. During this scenario, Alex is concerned about becoming addicted to drugs, so learners will need to provide education regarding pain management and drug addiction. Finally, in scenario 3, the learners visit Alex at home. This scenario occurs 5 days after being discharged from the hospital. Learners will complete a physical and psychosocial assessment, and during this time, the learners will need to listen and provide suggestions for Alex to access supports, as Alex shares that they are feeling isolated from their peers. And so I'm also just going to share a few tips from our pilot schools for incorporating these scenarios into your program. And so some of their feedback was, well, it's always important for learners to come prepared to simulations. For these ones, it was particularly important. For some, the content in these scenarios is quite unfamiliar and can be uncomfortable for them. So the more prepared the learners are, the better the experience is for them. Also, the content can be very unfamiliar for simulation facilitators. So making sure that facilitators are spending time becoming knowledgeable about the content is really important. During these scenarios, unconscious biases can be uncovered. So completing activities in the pre-brief to uncover these biases for students can be really helpful. Psychological safety, again, really important in all simulation, but particularly in these experiences, it was indicated that that should be emphasized. And finally, if the scenarios are completed in sequence, the learners become more aware of how to create an inclusive environment, and they become more comfortable with the content, and they also become more knowledgeable about the content. So if time permits, doing the 3 scenarios really supports the learners the learner's learning. All right, so I will hand it back to John.
So it's important for us to consider the way that we're representing our patients when we are providing education for our students. For these scenarios, standardized or simulated patients are recommended for all of the ACE Plus simulations. On the NLN website, there is a guideline for finding standardized participants for the ACE Plus Unfolding Case Series document. Just for some ideas on how to recruit appropriate standardized patients for use in the ACE Plus cases. We do suggest some different strategies to help find standardized patients. We suggest reaching out to local LGBTQ plus affirming organizations to really find the most appropriate representation for standardized patients. Some ideas for that include LGBTQ plus student organizations at your school or surrounding schools, affirming organizations in your community, not just healthcare organizations, but community centers as well. And then LGBTQ plus health clinics. Sometimes it's helpful to connect with the leadership at these organizations and these clinics to help identify patients. If you're not able to find an appropriate standardized patient for your case, we suggest using a mannequin. We want to make sure that we are representing the appropriate gender identity, sexual orientation of the patients, and we want them to represent those that they're portraying as well. It really is important for the fidelity of these simulations.
So this slide just acknowledges the people that contributed to this project. And we as the authors and subject matter experts, we wanted to express our gratitude to the schools that piloted these scenarios. We were able to incorporate your suggestions into this project, and the resulting changes improved the final scenarios. We also want to acknowledge the work of Dr. Beth Hallmark. She was at the beginning of this presentation, but her name is not on the slide, so I just wanted to acknowledge her, and also Andrea, who is on this presentation as well, for their expertise and support, because these enhance the project outcomes.
Okay, so where can we put this in your curriculum? On average, in baccalaureate nursing programs in the US, only about 2.12 or 2.25 hours of LGBTQ plus content is covered over the entire program. So I think it's important to note that LGBTQ plus individuals have been and will continue to be present in every aspect within the healthcare system. This content can be threaded throughout, but careful consideration must be made not to perpetuate any stigma within the population. So not focusing on certain things maybe that you find higher within one group than the other. Jayla could have asthma. Jayla could, be in a car wreck. There are different things that we can do to incorporate members of this population. And then the next slide.
Great, thank you, Brandy. So one of the things that I hope our audience is thinking is, this sounds wonderful, how can I access all of these resources? And so the way to do it is from the NLN website. You can navigate through the file system, but honestly, it's a little easier if you just type in www.nln.org/ACE plus written out, and then you'll come right to the NLN ACE Plus landing page. So this webinar is focusing on our ACE Plus unfolding cases, but we also have other resources. So I just wanted to let you know about those as well, because you'll see that there's 4 different boxes. Only one is unfolding cases. The other is ACE Plus teaching strategies. We have a teaching strategy on using respectful communication. And we also have 2 more teaching strategies that will be posted by the end of March. One on LGBTQ plus bias in healthcare, and the other on methods of gender transition. So please stay tuned for those coming out very shortly. We also have a page on the ACE Plus wet framework, which John talked about earlier in the webinar, and also an ACE Plus additional resources section as well. So by the end of the month, we will have a link to the recording of either this webinar or the webinar next week, which is a repeat because we had so many people registered for this one. But because we're here for the unfolding cases, if you click on the ACE Plus unfolding cases page, it's quite lengthy, so I had to truncate it, but it talks a little bit generally about unfolding cases, which Dr. Hallmark shared with us earlier. There's the no unrepresentation, which we also shared that, you know, these are 3 examples. They certainly don't cover the scope of the entire population. And then we have our 3 cases that we talked about, the Jayla, Mike, and then the Zach, Alex case. So if you're interested, we hope you are. Let's say you click on the Jayla Wright box. You'll then come to Jayla's website. So she has an overview. There's tabs for the 3 scenarios with the short descriptions of the scenarios. But really what you want to focus on is, depending on how you're looking at this, if you're looking at this on a desktop, you're probably going to see it over to the left. You'll see Jayla Wright and a download all files for this unfolding case. If you click on that, you'll get an expanded menu, which I'm showing on the right side of your screen, and it will tell you that Jayla has 11 files. This includes all of the simulation templates and chart materials, those instructor toolkits for the simulation and the monologue and finish the story. It also has the monologue audio file and the monologue script. So that is how you can access those files. So it's the exact same thing for Mike Walker and for Zach, the Zach Alex case. We have all the download files. There's also some additional files about for suggested learner preparation, which are files that are also included in the using respectful language with the LGBTQ population teaching strategy. And then it looks like we have some questions. All right, so one of the first questions is about accessing the templates. So when you ask for the templates, you can either, if you're speaking about the unfolding case ACE Plus templates, you need to go to the www.nln.org/ACE Plus and go to the unfolding case and navigate to the individual case that you want and then use that download feature. However, if you're asking about the NLN design, simulation design template, that's actually in the NLN Simulation Innovation Resource Center, which is at nln.org/SIRC, S-I-R-C. You can navigate to that. All right, so I wanted to have an easy one as we've populated our chat. We have, let's see here. We have a question about focusing on care transitions, and this is a great question from Shannon. We'll try to get to as many questions as we can. And Shannon was asking about how would we recommend upgrading these to graduate level education. And this is a great question because the ACE cases are all they're created for use with the undergraduate population, but they can be adapted. So I'm wondering if either Brandy or Leanne, one of our unfolding case authors, would be willing to share some of their ideas about how it might be used in graduate education.
Yeah, great question. I think you could look at it, for us, it's focusing on providing safe space, gender affirming care, that type of thing. So any, assessment course, I know where I teach graduate level, and we have a culture course where we talk about different communities and populations. So those are really areas. I mean, I think it should be threaded throughout. If you have, women's health is inclusive. So if you look at, you may have a trans man who gives birth. And so just having these conversations and prepping your students to care for people who don't just look like us. is really the focus. But great question.
Yeah, thank you for that, Brandy. I have just an additional thought to that. I think really, as Brandy mentioned, the main focus of these scenarios was on creating that affirming environment. So I think you could just modify maybe the illness that the client has, and just kind of level that maybe to an area, but keep the storyline the same. And I'm thinking about for Zach, as he changes his pronouns to they, them, and theirs, and changes their name to Alex, just thinking about using kind of that thread, but maybe the condition could be leveled, or the setting could be leveled to something else.
That is great. So we did also have some questions about the Zach Alex scenario, depending on whether you're starting with in the first scenario for it, he's Zach, and then in scenario 2 and 3, they're Alex. And so one of our attendees was wondering if there's any content or information about interacting with the parents in that scenario.
Yes, so in scenario 2, Alex is in the hospital with their mother. And so Alex's mom talks about, there's a bit in the scenario about Alex's family using their correct pronouns. And so that piece comes up in scenario number 2.
I also, I noticed in the chat, and we're very impressed. We have one of the authors who actually recently wrote an article, and actually John just shared this with us yesterday. And it looks like we have one of the authors on, and we were going to share the citation. It looks like you already have, but it does reference these cases. And so I have the full citation. I just popped it in, but if you're looking for a little more information, this article is hot off the presses, and so we're so pleased. I was pleased with the very quick turnaround with this. So we do have a question about kind of using standardized patients, and do we have any additional tips for how to use standardized patients or prep the standardized patients for these scenarios? I'll toss that out there.
I can just speak broadly about that. Just to reiterate kind of what I said before, I think it's really important for us to have standardized patients that represent those clients that we're actually incorporating into the case studies and the scenarios, just for accurate representation. We don't want someone to pretend that they're gay or pretend that they're trans. We want actual representation of these folks. And if we can't find that through affirming centers or organizations on or around our campuses, then we need to utilize mannequins for that, because we don't want to, it would be a disservice to that population, that community, if we are not using the actual folks to represent themselves.
That's great information. Thank you, John. And then we also have a question that I often field at the NLN, and it's about whether you need permission to use these, and whether you can link these to a learning management system, or the best way to go about that. So just to let you know, you do not need to ask for permission for non-commercial use. So if you're using in your classroom with your students, you're free to use, adapt the presentations without asking for a specific permission from the NLN. So we can take care of that. As far as using it with your LMS, the classroom, you can link directly to our website. At times we realize, at least once a year, I go through and I update links for references, just in case sometimes people change their URLs. So that could make it easy if you just link to our website. However, if you're adapting the materials, you probably would rather have it just download it and load it to your LMS. So it really depends on what best works for your situation. I'm seeing a lot of comments just about thanking us for exploring this topic, and that this is something that is very important to use. Someone mentioned they're using it in a social justice course. That really, these type of comments really fill our cup. So thank you so much for for sending, in addition to your questions, many comments to that effect. I'm also seeing a question about the teaching strategies and asking if they include ideas on how to present the case studies in a classroom setting rather than simulation. So our teaching strategies currently, in certain other populations, we have those type of teaching strategies. For this grant, we had funding for 3 teaching strategies, and so none of them are tightly linked to the unfolding cases. So I wish we could do more, and you never know, sometimes we do receive additional funding and can extend some more topics in our teaching strategies. So that's a good idea, and we'll keep that in mind. Let's see if I'm seeing anything else. Someone asked about CEUs. Unfortunately, we're not able to grant CEUs for this webinar. And I'm also seeing a question about the recording, the audio recording. So we will have the video recording available. Again, it's on the ACE Plus website. It will be under additional resources, and it will either be this recording or next week's recording. So it's a good time to have a shout out if you do have a colleague or someone that you think would benefit from participating in the live webinar. We are doing this again next Thursday, but an hour earlier. And so we'll be here. The registration link is on the NLN website. It's either under the ACE Plus additional resources page, or it's also, if you go to the NLN website and just go to the events, it's listed there and you can get to the registration page. So that's another option as well. All right. I think we've got a few minutes left. Do we have any?
I just wanted to say, when we didn't talk about finding Jayla's voice. And so if you wanted to share with that she is a person of color who is trans, like that was really important for us. We got a lot of straight white women and we kept saying, no, thank you. So yeah, we really truly did want to be authentic and represent the community. So yeah.
Sure. No, that's a good way to end it, is that you're correct. All of our monologues, we did follow our own best practice guidelines, and we did seek out voice actors who matched the sexual orientation, gender identity of the person they were portraying. We also received a bit of pushback from our normal casting, who we use to cast all the other ACE populations. And so we had to cast a much wider net than we usually do. So I think there's a good parallel that, maybe if you've used other ACE populations before in your classroom, you may also find that you need to kind of expand. But Brandy is correct. Jayla took a lot of time to cast. We actually missed our deadline. We wanted to have her ready for the 2022 summit, and we just couldn't get the right fit. But we did find a woman of color who identified as trans, and she was willing to read that. So, and the same thing with our Mike Walker and our the monologues, actually Zachary. So we did that so that we're following our own best practice. So, all right, let's see here. We have a few more minutes. Is there a link to the best practice guidelines? I believe you're talking about the recruiting the standardized patient. So that is available right on the ACE Plus unfolding case page, but I also just drop that in the chat as well, just to make it easier for everyone. All right. So I think I just want to thank everyone for coming and attending today. I want to thank our guest here. I know that Beth Hallmark had to leave a bit early, but I want to thank Brandy, Leanne, and John for taking us through this presentation today. And finally, I do want to have a final thank you to the Hearst Foundations for funding this great work. So thank you all, and I hope you have a wonderful rest of your day.